Toes. Yeah, there you go.
Oh, I got it.
You got it.
I got it. Too good. I used to play basketball.
Okay.
And then I kind of tweaked to playing basketball.
I feel like it got like kind of misaligned or pushed out of position and then kind of put it back in, or how did you
I wouldn't say it was like a dislocation because
Okay.
I've had knee problems before in the past too. So I've dislocated this knee twice.
Okay.
So I was playing basketball and then I played football as well. So that's why that one dislocated. I have a lot of.
We'll go through all of it. You're good. Tell me about the knee. Tell me, is there any pain currently in the knee?
Nah, there's no pain in the knee. I definitely feel like I don't have a lot of, I don't want to say a lot of range of motion. It's more like the knee was bad, so it I don't want to say overstimulates this right leg, but it usually compensates for this right side, and then it's kind of getting into my lower back.
Okay, I'm gonna take a little side here. Go ahead, stand up for me. I'm just kind of curious.
Yes, sir.
Put your leg up on the table, kind of like me.
Okay.
All right, and now try to come down and sit.
I wouldn't say I have bad range of motion sitting down like
Does it
on
hurt?
my knees. No, it cracked a little bit though when I did it just now.
But no pain.
Nah, no
All right,
pain.
do the other side.
I know you heard that.
Yep. Any pain when you come down like that?
No pain.
Okay.
I'm usually good with like stretching and stuff. So like I said, I've been trying to get into the gym more, so I don't mind stretching. It's more just like my lower back.
When you say dislocated, you feel like you tore one of the ligaments, or?
It wasn't a tear. It was like my patella tendon like had came to the side. Yeah.
Okay. Gotcha. And so it just kind of resolved. Did you have pain around the knee?
When it first happened, I got PT, and then
Uh-huh.
it happened again, and then we did PT. So I followed through with my PT for like the 4 to 8 weeks that they had gave me.
Okay. Cool.
And then I didn't really like keep up on my PT training, but like they cleared me for everything. So.
Do you ever feel like the knee is unstable when you're walking or playing sports at all? Do you feel like the knee could give out at all, or
Sometimes, just like on a stability sense, yeah.
a little bit unstable?
Yeah, maybe when like I'm being active though, like, because I still try to actively play basketball sometimes.
There's two collateral ligaments, and then there's two cruciate ligaments. We call them the ACL, PCLs, or the two internal ligaments that you'll hear people, that's when they operate on. Those ligaments prevent sliding forces on the meniscus. So that piece of cartilage in your knee doesn't mind compression. It just can't handle sliding, the kind of grinding forces. So
like
when
your teeth grinding together, kind of, in a sense.
Right. And so what happens is when we have prior ligament injury, it makes meniscus injury happen easier over time, especially if you're noticing, I kind of feel like it moves in a direction it shouldn't. And I would encourage you to do that, what we just showed you. Maybe we'll go over it again. But that stretch I just showed you opens up the meniscus, and the meniscus is really the foundation for every knee surgery. The ligaments they do because we're trying to prevent meniscus injury, right?
Yeah.
So we're doing surgery on, well, no, I had ACL repair, correct, because they cared about your stability so you wouldn't damage your meniscus.
Right.
The meniscus they previously told us it doesn't heal, when the reality now is about all the meniscus can heal, but a lot of the blood flow is so poor in the knee that about 1/3 of it ends up not really healing well, and the stretch I just showed you helps push blood into the knee, and that keeps the knee healthy. But the shoulder, you said, so this is called the glenohumeral joint. You feel like is there any pain, like say when you move it around at all?
I wouldn't say there's no pain. Well, yeah, a little bit actually.
On the AC joint there on the front?
Right,
Yeah,
yeah.
we'll clean that up. Yeah. The main thing I find with the shoulder is that when we have an injury, typically the shoulder goes forward and down.
Yeah.
And this is coupled with the fact that we typically, if we sleep on our side, it's very hard to sleep on your side with your shoulder back. It always goes forward. And so if you're a side sleeper, which we need to be a back sleeper, but many times we go to our side, sometimes because we have back problems that we get away from by going to our side, and then that feeds a shoulder. So now we get a rotator cuff injury. So you probably heard rotator cuff tears. The rotator cuff muscles, supraspinatus is the main one. It starts right here and then it attaches over here. The more the shoulder goes forward, the more the fabric is held tight, like a rope. And if you hold a rope tight, you can cut it easier than if it's loose.
Yeah,
right?
but there's no slack in between.
There's no slack.
Yeah.
So the alignment of the shoulder makes tearing the rotator cuff easy. And so that's what you're young enough that, okay, we don't have any rotator cuff tears, but we have injury, and that's going to cause shifting of the alignment, and then 30, 40, we have a rotator cuff injury. And how did this happen?
Right.
Well, it's because nobody went in there and cleaned up the shoulder post-injury, and it healed crooked. So we'll check all that out. I'm just curious, if you just, when you're turning your neck fully left and right, is there any pain when you turn your neck?
No, I wouldn't say so. Not right or left anyway. I
Okay.
think when I like put
Look
my
up?
when I look up or down. Sometimes when I'm like in a certain position and I look down, I'll feel like my lower back right here. It's on the right side. It'll be like right in there, and then I'll look down.
Is it
And then-
sore when I push?
Yeah, like right
On the right side?
Yeah.
Uh-huh. All right, so what you're pointing to, right? You're pointing right to the knuckle. If there's joint injury, there very likely is also disc injury, and the disc is the foundation for every back surgery. So you'll hear disc herniations and disc bulges.
Yeah.
So your pain is not disc injury; it's the joint capsule upset. But it's likely that at the same time that the joint got injured, the disc also got injured, but we can't
Yeah.
feel the disc. So how do we evaluate the health of the disc? We're going to base that on how willing your spine is to being curved.
Okay.
Right, so we're going to adjust you, loosen you up, and then I'm going to aim you at the end of the visit. Now, 22, I expect a lot from you. Ed, you're being pretty mean to me, aren't you? Because you're 22. Right?
Yeah, young.
I expect you to be able to lay on that piece of foam. I'm almost. I am 40, and so
You young, man.
Thank you, Brad.
My parents are like older in their 50s, 60s, so like I definitely get it.
I appreciate it. But my point is, I'm 40,
Yeah.
and it's a joke, and so I expect 26 is when the spine reaches full maturity. All the growth plates harden, the clay or the cement kind of fully hardens at 26. That's when it gets harder to change posture.
Yeah.
So we have now the 26 is your best chance in investing in your spine to aim it back into an alignment that is conducive for 90 years. We want to aim you for a long period of time. And we don't live in a world with many alignment specialists. We live in a world where everybody's just a symptom doctor. How do you feel? Where's your pain? That's a lot of other chiropractors that maybe you've been to. Tell me where you're hurting. And I don't really treat symptoms. I'm going to listen and I'll work on your symptoms. But long term, I aim for posture. That if we're in the right alignment, there aren't symptoms. If your neck is curved, that means the spine will age as a teen and no one vertebrae is under too much stress. Feet flat, but you keep the feet flat. There you go. Cross this arm right under and then over. Do a little sit up for me. Take a deep breath in for me. Let all the air out. Try to relax your chest, bud. Relax. Good. Deep breath in. I got you. Head back. Let it all go. Good. Deep breath in. One more. Exhale. Let it all go. Let it go. Chin down. Beautiful. Everybody moving. That's good. Let's have you scoot down and then on your side facing. All right. Take a deep breath in. Easy, easy. Exhale. I got you, bud. It's okay. Good. Breathe. I got you. Exhale. Exhale. Beautiful. How's that for me? You told me it's hurting here, so what we're going to do is we're going to adjust above and below,
okay.
right? So we're going to move the stress. I'll show you again on this side.
Yes, sir.
Bottom leg straight, you got it. Put it back. Yeah, you go. Perfect. Put your back of your head on there. There you go. Perfect. I'll slow it down this time for you, but. So this area is overstressed. Get the idea? So we're going to adjust up here and here to take the stress off the lower back. Got you. Breathe. I got you. Exhale. Good, good. Deep breath. Exhale. Let me try to close this joint. Good. Perfect. So face that for me. All right. Huge left atlas. Feel this big bump right here? Right? Can't even hardly feel it. Feel the difference?
Yeah.
There's a, whatever you want to call this Frankenstein bolt, this is the side of your atlas. It's basically your head likes to tilt to the right. Now I'm going to tilt you to the left and see if I can see right about there. The bone is now level. Do you understand? I can now feel the right atlas because I tilted you to the left. So the bone is now level, but your head is now not level with your shoulders. You follow me?
Yeah.
And so when we're a kid and we crash our bicycle and the handlebars and the tire don't line up, right? Your handlebars are crooked to make your tire straight.
Yeah.
Right? So this is going to wear out the right lower part of your neck. Having your head in misalignment is going to age the right lower part of your neck, and no one really cares until it's done.
Yeah.
Right?
And that follows with like sleeping on your side?
Well, it means that you like to sleep on this right side.
Yeah. No, for sure. 100%.
You're, and it's more about an injury or something happened. Maybe this, like I said, this left shoulder. You're going away from this left side because of injury, and now, I mean, it's not minor. It's a medium level misalignment. I have a huge. You know that bump there?
Yeah.
I can't even feel your right
side.
atlas.
Yeah.
So this upper neck will not be where the long-term injuries are. It will be in the lower neck, because this is essentially misaligned and crooked, and the lower neck is going to have to eat it. You understand? Cervical 5, 6, and 7 in the lower neck are typically where all surgery happens, but it was an alignment issue at 22 that caused a disc injury at 38, right? So it's an investment where my message for you is, of course, we're not at an emergency level, but we're going to prevent something 20 years from now from happening. There you go. There you go. Yeah. We'll do that again in a second, but yeah, it's tight.
Yeah.
Okay. That left side's a lot tighter.
Yeah, the left side definitely is. I definitely felt it.
Correct.
Like a bigger crack on the left side, even though I know you probably heard it louder on that right.
Correct. It's still stuck. I got about half of it.
No, I feel it. Don't worry.
But right. I mean, we could name it. I usually name these after old girlfriends. Tracy. Wow. Jeez, bud. I'll show you the right in greater detail in a second, but that is, I'm sorry that nobody else pointed this out.
No, it's okay.
Nobody showed you this nugget, this Frankenstein bolt on the left side of your neck.
I mean, nobody knows except me, and now you.
Right. But that's an injury. You weren't born with this.
Yeah.
I mean, it could have been a birth trauma, I suppose, but this has grown over the years, or at least been fed. So this is the gua sha. It's a little comb with a smooth edge. Just helps to bring blood in, and any area that has been stiff for a while will trap lactic acid. Inflammation will get trapped in those tight areas, and I suspect this area will be right there. A little mark starting to come out. See right there. Try for the viewers at home. I'm not going that hard, right? This is pretty gentle. I'm not like.
No, yeah. Pretty
but
gentle. It's
pretty gentle. It's not supposed to be like we're.
But when there's something that's not supposed to be there, it's
that's right.
Feel a little.
Yeah, you got it. Okay. There we go. But yeah, right there. See all that? It's nice being 22.
Yeah, I gotta take care of myself while I'm right here, right?
Well, it's easy to change your posture. I'm just telling you. Versus 32.
Yeah.
You can blow right through all this difficulty, easily. Versus 32, you're like, man, this is hard, Ed. I have a lot of soreness. While 22, it's like couple visits, couple weeks, you're through it. You won't have a huge amount of need for care at this age. It's really me giving you a toothbrush, teaching you how to brush. Have a good time out there. You don't need 3 times a week the rest of your life. This isn't what chiropractic is supposed to be for you.
Yeah.
It's equipping you with the tools, understanding your spine, realizing that you have a favoritism to tilt your head right, and first way to solve a problem is to identify it, right?
Yeah.
And it'll be a battle that you're going to have to confront until you start noticing that you're, daggone, he's right, I keep wanting to tilt my head to the right.
And then it's just a mind game at that point.
You got it, you got it.
Get it together.
You got it. There it is, nice.
You could definitely tell, but like the difference between like the severity.
Sure, it's pretty obvious.
Yeah.
Do you play sports often still, or just?
Not as much. I really work a lot more than I play sports. I have 2 jobs. So
gotcha. You're
trying to get it together.
Sure, cool. I got you. Just checking.
I didn't know you and your sister were sisters though.
Yeah.
Like I never knew that, and the entire time I was like watching with you guys. It's like kind of crazy.
They seem to adjust very similarly, but
yeah.
We both were taught by my father. Our father's a chiropractor.
Oh, okay.
And then we have another brother who's a chiropractor, so there's 4 of us.
Nice.
And we're all trained by the same chef.
Yeah.
So mechanically, the reason why the right lower is under more stress, why you pointed to it earlier, when I look at your back, the left side is more elevated, probably about a 1/4 inch, maybe close to a 1/2 inch higher than your right side. So you're essentially in avoidance of this region right here, and that's throwing the work to the opposite lower.
Okay.
But the way we fix it isn't to directly work on the lower back. We
Work on the
level
muscles
out and restore functionality. There's a word that maybe you heard it at other chiropractors, and I haven't used it today, which I'll finally use today. Subluxation, right? Subluxation means sub meaning less than, luxation means dislocation. So subluxation means less than a dislocation. Okay, so I'm not saying these are dislocated.
But
I'm saying they're crooked.
Okay.
Right? The bones are crooked. The car's in the garage, but it's not in straight.
It's not parked right.
Or like that person that's in the parking lot that didn't get in their space properly.
Yeah.
Right? It's like, daggone it. The first problem is chiropractors believed and still believe that an adjustment can change it. And I say good luck with that. There is no adjustment that will
ultimately permanently change the position of the bones. Maybe temporarily they can change for a few minutes, but to change permanently the position of the bones, we have to stretch. It was years of stretching and being held and sitting in school and life and avoidance that put this out of alignment, and so it's time in what we call the mirror image stretching to restore that alignment to what we call the ideal alignment. And this alignment is going to age the right lower part of your back at twice the rate that you normally age.
Yeah.
And no one really wakes up until it's damaged, right? And then you go, oh, I should have been changing my oil. I should have been checking my tire pressures, right? Until I blow the tire off the rim.
Right. Should have did it 1,000 miles ago.
Right. Doing great. Yeah, pretty obvious though, right here. When we stretch at the end of the visit, you might even feel like you're crooked on my device. You would be like saying, Ed, I feel like I'm not on it straight, when in fact you are, but because your back isn't level.
I'm not used to it.
Right. Your back is unlevel, and it'll make you feel crooked, and as you master the stretch, you will then start to feel like you're on it straight. Don't be disheartened, or it'll be a way you can tell. Are you sure that device is on my back evenly? It is, but your back's crooked.
Yeah.
Which is making it feel awkward.
It's not the device.
It's not the device, it's you. It's my favorite. You ever seen Inception? That movie Inception? No? Leonardo DiCaprio, it's like a dream movie. And he talks about like the subconscious attacking this other person. And she's like, what, is it going to attack us? And he goes, no, just you. Right there. There's the epicenter. And nobody's shown you this, right? Nobody has gone up here and showed you this knot up here.
It's okay. You are.
There you go. Doing good, doing good. Doing good. Right there, jeez. Part of is that your shoulder is being pushed forward on the left because of this in the way, right? You actually can't, your shoulder on the left can't come back. Does that make sense?
Yeah.
Because all this is in the way back here. Just relax, now you can relax. I just want to, that this is connected. All of these knots back here are a part of why the AC joint, eventually the glenoid and the labrum, but this back here is growing bigger, and that's shoving your shoulder forward away from it. And it's really, to me, a back problem that creates a shoulder problem. Or at least, I know you had an injury to your shoulder, but now it's going to make it worse. I'm just curious, are you left-handed?
Right-handed.
You are right-handed?
Yeah.
I never found it to correlate. It's fine. Again, almost. My dad's right-handed. You have my dad's neck, actually. That left knot is more my dad's. About 80% of my patients have the right knot. And I've never found it to correlate, and you're my proof that it doesn't correlate. Because if you were left-handed, then it would actually start to correlate that the knot on the left is because he's left-handed. But I have, and I think, what is it, generally something like 85% of the population is right-handed. So I was like, well, maybe all the right knots are directly correlate with the, I think it's more birth trauma or just injury, but.
How do you deal with that when people are ambidextrous?
Well, I don't think it correlates. I think it's completely independent. My suspicion, I'm collecting data.
Yeah.
I just collect data points from people. Carlin's a right, I'm a right. It's like earlobes attached or earlobes free. You know? Ta-da! Sorry.
You're good.
The mark comes up quickly, right where that.
Yeah, I already know.
Crunchiness
That's
is in
all I
there.
was thinking about.
Yeah.
Is how crazy that mark is about to be.
Yeah. You just- The cool part is that I really can't make a mark if there's nothing inside to draw out. It's like
Yeah.
a vacuum cleaner. It only can pull the dirt that's in the
You can
carpet.
only
It doesn't-
take what's coming.
You only can take what's there. Yeah,
Yeah.
you can't. Doesn't put anything there. And so, what happens fairly quickly, especially at your age, is that after a handful of adjustments, I won't be able to make a mark. You'll go home and somebody will look at your back and go, "Is Ed slacking off? Is he? He's not seeming to be making marks like he used to." No, you're doing better. And
Just means you're healthy.
that's right. If you got it, you got it. But, or even what used to be tender when I worked on you now is no longer tender, and you're like, "Ed, are you pushing easier on my back?" No, your back is no longer tender,
Yeah.
and I'm pushing as hard as I can, and it feels like a cakewalk. Just becomes easy. So these muscles are having to work much harder because of the alignment of your shoulder. The
Yeah.
rotator cuff muscles are under a lot more stress. They're essentially playing tug of war with the pectoralis muscle in the front. So the pec pulls the shoulder forward, these muscles pull the shoulder back, and these guys lose.
Tug of war every
The
time.
pectoralis always wins that battle. It's a dominating upper body muscle. And so what we're seeing on your back here is the evidence of these losses.
How bad does it look?
Well, there's infraspinatus is all filled up back here, rhomboids a little bit. These muscles have been on a losing streak.
Yeah.
They're covered in mud, getting pulled into the mud pit by the pec playing tug of war.
Yeah.
Mm-hmm. And I can feel like right there. That's that one. I'll show you. I'll take a picture, but yeah, you'll be able to see. Mainly just right here, right there on the back of his humeral joint. All right.
And so that low back joint of his will calm down as his middle back.
Yep, it's simply hypermobile. It's so hypermobile that when you tuck your chin down, it's moving. The only
Yeah.
reason you can feel that is that joint is so mobile that it's already stressed out, but then you tuck your chin down, which opens the joints and moves the joints, and so you have a joint so loose at the bottom
It adds
that
flair.
it adds to there. And as we get the upper back and other regions of your back moving, Ed, I don't feel it anymore. Correct, because now you have other participation, other vertebrae functioning as a team. And then the stretching that I'm going to show you in a minute is how you retain it. It's a retainer like the orthodontist gives that prevents the teeth from going back to being misaligned. The stretching is really how posture is changed. You're doing great.
Yes, sir. This side's easier.
Yeah, I know it's a lot. I don't have nearly as much crunchiness. Lift your head for me. Put your forehead around your forearms. Keep that forehead to forearm contact for me.
Yes, sir.
Okay, bud. Take a deep breath in. Keep that forehead to forearm. And then exhale for me. Exhale. Here we go, bud. Nice. Good, okay. Doing good?
Yeah.
Yeah, you did good. Arms down for me. Take a breath for a second. Yeah. There's that left side. You're pointing to pain down there on the opposite
Yeah.
right.
That's crazy though.
That's where all the stiffness is. Right there is where we're going to be
Yeah.
focusing on, and then your neck,
Yes, yeah.
that left knot.
That's crazy.
People are going to start to, what the heck is that?
Yeah, right.
Okay, all right. You can't let this area stay sore. The stretch I showed you earlier, I want you working on that 10 times every day. Just kind of get a chair. 1. You understand? 2. And you have to pump that soreness out of there. It can't be
Yeah.
tender like that. If you feel tender, I'm not pushing hard. I'm just, you understand that the meniscus should have no tenderness in there. What happens is the tenderness is lactic acid. Acid will eventually eat away at that cartilage like a piece of bacon. It starts to cook it, and it goes from soft, flexible to hard and crispy. and that's what we call desiccation medically, but it's eventually the age of that meniscus is gonna age at a more rapid rate because it's been injured.
So much more.
Yeah, I got you want to rub around the knee, but ultimately, like stretching the quad happens in that stretch I just showed you. All right, there we go. Nice and easy. Good. Nice and easy. Good. It moved, but yeah, it moved already. 2, 3. So I'm 9 for 10. Yeah, this guy here, this again on the left side. Yeah, something happened to this guy. Probably the same time when this got injured.
No, I know. I think I know what that is. I think
Okay.
when I was younger, I was younger and I was helping my mom with like Thanksgiving, and I think when I was a kid, and like a can had fell on my face.
Something happened in
Yeah.
here. Just try to traction and then curl. You're working in this direction. Don't go like that. That makes it worse. You're taking the toes, you're pulling and curling.
Yeah.
The way you accomplish this at home is you're just kind of get the idea.
Yeah.
Right, so you take your foot, kind of grab it, and then you're kind of pushing. So we call this the phalange. This is called the metatarsal. You take the metatarsal, you push it in, and you curl the toes. Yeah, there you go.
Oh, I got it.
You got it.
I got it. Too good. All right, it's over.
Good.
Did you offend it?
There, now it's moving. Feel it? Now it's actually moving. Yeah, you got it. But just you got to work on that. You got to work on that. It can't. You keep that joint stays frozen like that. It'll keep getting more and more frozen on you. It'll lead to plantar fasciitis, bunion, drop metatarsals. Again, 30 years from now.
Yeah, but
This is not. This is all preventative stuff. Okay, press back with your elbow into my elbow a little bit. Press back. All right, so what you're gonna do is you're gonna put your hand around your hip for me.
Mm-hmm.
You're gonna keep your arm here, and then you're gonna press. You're gonna push backwards.
Oh, okay.
1 second. There you go. Switch around. Yeah. There you go. Yeah. Okay. Good. Exhale. Exhale. There you go. Let it go. Let it go. There you go. Beautiful. Nice. There you go. This is your retainer. This, like I said, you might feel a little left or right crooked, but it's because your back's one side's higher.
Yeah.
So
It
leveling.
just feels tense. That's all it is.
Okay, good.
Yeah.
You're doing great. I got it mostly leveled out by just adjusting you, but in order for it to change permanently, I can't permanently change it by lifting you up and it won't. The joints will the ligaments that wrap the spine have to be altered in their laxity. So the ligaments on the front are all tight, so they pull us forward. The rubber bands on the back are all loose, and so they allow us to be stuck forwardly rotated. And so we have to actually stretch the front part of our body so that the back side can come together. Come together. Come together on the back. This cervical lordosis or cervical curve is going to guarantee that your neck will age at an even rate. The structure called the disc is dependent on this curve for health. And the loss of the curve in our neck, because of all the hours of forward rotation and iPhones and school, we lose the curve in our neck. This then sets us up for lower neck injuries, disc surgery. How are we feeling now?
I definitely can go back way more.
A little more range of motion?
Yeah.
I know you didn't have any pain before. Kind of tilt the head back up again. Nice range of motion. Any pain? No, you're good. How's that feeling now with your chin tucked? How's that feel?
It's relieved a little bit off that.
Yep.
Like
Now feeling the pull down there?
Yeah, no, not at all.
Beautiful.
Cool.
You did really good.
Thank you.
Awesome, friend.
I appreciate it.
Awesome. You did great. Thank you.
Thank you.
Great.
Yep.